Welcome back. It's that time of year again. Flu season is quickly approaching as we move towards the colder months. But what is flu season and what can we do to protect ourselves in the wake of a pandemic? Joining us for a discussion on flu season is Dr. Cariane Morales Matos of Montefiore Health System. Doctor, thank you for joining us.
Thank you for having me.
So we're just going to jump right into it. Dr. Matos, I first like to address the misconceptions about weather and the flu. Can you explain what happens when we get the flu? And does weather play a huge role in this?
So that's a great question. The most important factor for you getting the flu is actually being exposed to the virus itself. If you haven't come in contact with somebody that has the infection, you can't really get it. So the weather doesn't really play a role in your ability to get the infection. There have been some studies that show that it is possible that the flu virus can become a little bit more stable and easier to transmit. And that might be why we see peaks during the fall and winter months versus the summer. But essentially, cold weather is not really what's going to factor into your risk.
So, as a health professional, what are your concerns as we approach this time?
So, my major concerns are that as the weather gets colder, we're going to start gathering more indoors, doing less things in the open air environment, and potentially having some family gatherings in closed environments. And that is most likely the biggest risk for you to be able to get infected or to transmit an infection like the flu.
So, the COVID vaccine still remains very controversial for some, but many are or were encouraged to get it as we approach flu season. Would you consider the flu vaccine just as important?
Absolutely. And in reality, unfortunately, a lot of the controversy with the COVID vaccine is mostly because of misinformation. And it's a very safe vaccine. But just as we are encouraging people to get the COVID vaccine, the flu vaccine is just as important because it can protect you, your friends, your family members from getting this infection or becoming ill enough to need to be hospitalized.
So, my next question is it safe for people to get both the COVID and flu vaccine? I know a lot of people are already afraid of getting the COVID vaccine, and now we're adding another one on top of that. What are your thoughts, and is it safe for our families?
They are very safe, both individually and they're safe to be administered together. Really, the most common side effects for either of those vaccines is tenderness at the site of the injection, some swelling and redness. And those symptoms tend to get better within a day or so. And having them both together, both of them are still going to give you antibodies to protect you against these infections. And two, just because you're getting them together doesn't mean that you're going to get more side effects or worse side effects. They're completely safe. And if you haven't gotten the COVID vaccine yet, you should definitely get it. If it happens to coincide when you're getting your flu vaccine, that's not going to be an issue.
And so I love that you kind of mentioned the symptoms. Can we go over that a little closely? Because I know a lot of people will say, I got the flu vaccine and I got sick, so I'm not going to get it again. Can you just explain what vaccines actually do and why that's important?
Absolutely. So that is an awesome question because a lot of people tend to have that misconception as well. So the flu vaccine in itself, you cannot get the flu virus from it. The majority of the vaccines don't actually have a live flu virus in them. If anything, they might actually have a piece of the virus or they might have a non-live virus, which the reason why that's there is to make sure that you can create antibodies that can recognize this infection and give you protection. But you cannot get the infection itself. Most often, we're getting these vaccines around the time where the flu season starts. So it is possible that you may have already been infected when you go get the shot and then, in fact, develop a full infection, but you were in the incubation period when you got the vaccine. But you cannot actually get the infection from the flu virus from the flu vaccine itself.
Okay, thank you so much for that because I was just always really curious about that.
Yeah, no, it's a great question.
So, at the start of the pandemic, there was this idea that COVID and the flu were very similar, and at times, many people claimed they were exactly the same based on their symptoms. Is this true?
So Unfortunately, in the beginning, we didn't have a lot of information about what this virus was, what the symptoms to look out for. And it's because it was a brand mutated coronavirus that we had never seen or treated before. We knew from the beginning that it was a different virus. Separate from the virus. If anything, the only thing that they share in common is that they cause respiratory infections, and they can be spread rapidly. But besides that, they're completely separate virus families. They don't cause the same infection. Um, the fact that we didn't know what was going on because we didn't have a lot of cases when this first emerged meant that we unfortunately did not transmit the correct information in the beginning. We weren't able to tell people what to look out for. And we unfortunately learned things like the easy transmission rates of this virus, how deadly it was along the way of the progress of the pandemic, because we then acquired experience when we were going through the peaks when it first happened in California and Washington State and in New York and now in some of the southern states. A lot of this information didn't really exist before a year ago. So that had a lot to do with the confusion and the lack of clear answers that we had in the beginning.
So, do they have any symptoms at all that are similar that can also make it confusing for some people?
So the overlap in symptoms between these viruses is so big that it is virtually impossible for you to be able to differentiate them just based on symptoms. They both cause fevers, chills, sore throat, general feelings of achiness and pain everywhere, tiredness. In some people, they can also get diarrhea, upset stomach. So it's very difficult, and it wouldn't be wise for somebody to say, I don't really have all of the symptoms that match me for COVID, so I'm not going to go seek attention or help. And it's also super important to keep in mind that for both influenza and for COVID, the therapy we have available majorly depends on our ability to diagnose you early when symptoms start. Because after about a week or so of symptoms, the medications have not been proven to work. So it's very important that if you do have symptoms, go get tested. It's very broadly available. And if you do have an infection, that can be treated and managed.
So that's so interesting that you say that because that was going to be my next question. What can people look out for, just to see if like maybe if they're different or anything like that? But what do you suggest if someone's a little bit unsure if they don't know if they have the flu or COVID?
So again, get tested as soon as you start getting symptoms. If you're worried because you don't have a good sense of smell or taste, or you're starting to get fevers or cough, basically there are still many testing sites all over the city that are offering either free or low cost testing. Visit your primary care doctor, who often can also do a flu test or a COVID test, and get the answer. Because, as I said, if we know that you have the infection early on, we can give you the therapies that can either slow down the symptoms or prevent you from getting ill enough to need to be in the hospital.
So this is going to be, a time in our lives where, we're very vulnerable in regards to health. I just want to know, is it possible to have both of them at the same time? And what does that look like in your body?
Yeah, so unfortunately, because they are two different viruses, you can get infected with either of them at the same time. Um, we don't really have a lot of experience with dealing with both infections at the same time because last year we barely had any flu cases. A lot of that had to do with the fact that the same protective measures that we're doing for COVID also protect you from flu and other respiratory viruses like masking, keeping 6 feet apart, not going out when sick, avoiding crowded places. So it's hard to tell whether or not you're going to get very sick from both of the viruses. Just if you get co-infected, I would assume so, because if you already have underlying conditions like asthma, chronic respiratory conditions, hypertension, if you're pregnant, or small children already, when they may potentially be infected with the flu, potentially could have worser outcomes. So if you were to get infected with a second virus, it is possible that you may also have a severe disease from the subsequent virus.
So you mentioned a little bit that took these preventative measures last year, but I feel like I see a lot of people kind of relaxing on those measures. So I'm seeing more people, not wear their mask or not staying 6 feet. Do you have any fears about that as we approach this flu season? Just about how more relaxed we've been when it comes to COVID?
Yeah, absolutely. I think that how maybe comfortable we may have become since the vaccinations for COVID have become available may increase our potential flu cases this season. And my advice for my patients and for anybody watching this broadcast would be to still mask as much as possible. Avoid going to crowded places if you're not feeling well. Continue to distance yourself 6 feet from people that you don't know or not from your household, because really these same techniques are good for any type of respiratory infection, including the flu.
All right. And lastly, can you just tell people where they can go to learn more information about keeping their family safe?
Absolutely. So the flu vaccine is very widely available. So you should be able to get it either at any community pharmacy or big retail pharmacy like Walgreens, CVS, etc. You should also be able to get it at your primary care clinic. Highly encouraged to call your doctors to see if they have it available and when you can get it from them. And Montefiore partners with Walgreens and has available sites at free or low cost to anybody who would like to get the vaccine.
All right, doctor, thank you so much for joining us.
My pleasure.
We'll be right back.